This is the introduction to GGM Humidoflo Nasal High Flow Therapy System HF2900D. Humidoflo is certified by CE, ISO 13485, and GMP. This year, it also qualified as a Taiwan Excellence product. The system includes Humidoflo, implanted with a flow generator creating flow from 5 to 50 liters per minute, delivering blended oxygen concentration from 21% to 100%. Pressure line and heater wire adapter. SpO2 sensor, connected to measure patients' SpO2 and heart rate from their finger. Auto-feed water chamber, where gases are warmed and provided with an optimal humidity. Breathing tube, heated to minimize condensation. And a variety option of GGM's Ultra Comfort patient interfaces, including 3 sizes of adult nasal cannulas, neonate interface, and tracheostomy interfaces. The system can be installed on a trolley to facilitate the bedside treatment. Now, let's take a look at the technology that makes it possible. Room air and oxygen are collected by a quiet motor through a filtration port. Before entering the flow generator, a blending space is provided to allow the oxygen and room air to evenly mix. The flow generator creates flow from 5 to 15 liters per minute for infants and 15 to 50 liters per minute for adults. Then, the blended air enters a heated water chamber where dry air is heated to 34 degrees Celsius and humidified to optimal humidity. The heater wire in the breathing circuits warms the air to prevent condensation. Meanwhile, it brings the airway temperature to 37 degrees Celsius. A temperature probe and pressure line are also installed in the tube, enabling Humidoflo to detect the airway temperature and proximal pressure. The Humidoflo finally interacts with patients via our high-flow interface. It is ultimately comfortable, convenient, and widely accepted by a full range of patients. Patients can eat, drink, and talk during treatment, significantly increasing their living quality and dignity. The adult and infant interfaces are both designed as a large-bore nasal cannula, effectively washing out the dead space and reducing CO2 rebreathing. The humidified flow can improve ciliary movement and accelerate sputum dilution and exclusion, thus decreasing patients' infection rate of pneumonia. Since the air and oxygen mixes before entering the flow generator, the oxygen concentration is relatively stable. Operators can also adjust the concentration of oxygen according to patient's need. Now, let's examine how Humidoflo benefits the patient. Applying Humidoflo, patients may experience accurate oxygen delivery. Oxygen therapy delivered through Humidoflo heats and humidifies the gases with flows up to 50 liters per minute, reducing oxygen dilution. Optimal humidity provided, which moisturizes airway, improves mucus clearance, and accelerates sputum exclusion. The comfortable and effective nasal interface is widely accepted by patients, which consequentially improves the recovery rate. Compared to traditional ventilation, Humidoflo applied with GGM's Ultra Comfort large-bore nasal cannula is more patient-friendly than the uncomfortable experience of a face mask or incubation of traditional ventilation. The literature shows that early application of high-flow therapy can prevent unnecessary incubation, and the non-invasive interface of NHFT can also reduce the risk of infection. Humidoflo has a wide application and could be used in the following circumstances. The Humidoflo, together with GGM's Ultra Comfort high-flow interfaces, provides a versatile and easy-to-use system for delivering high-flow therapy. It will ease breathing, reduce the risk of infection, and improve mucus clearance in patients suffering from a wide variety of respiratory conditions.